want to see next when we start up again in the fall. This resource fair is for patients who are undocumented. We'll be presenting resources from 2 different organizations and getting some tips as far as how to navigate patients without documentation. We have the Colorado Community Health Network and we have Vuela for Health. 2 different presenters, and I wanted to share our agenda. And with our agenda, I'm just going to share a quick.
Did you send like more business cards? I did. I have ordered them before. Sarah's been in the meeting.
Overview all the different organizations that we've had present at our resource fairs, and yeah, all the contact information that's in there. So some things I wanted to share about UndocuHub. In the slides that we'll be sharing in the follow-up email, we have the website link, the phone number. We wanted to highlight that it's specific to Colorado. And they also have some upcoming trainings. So it's a primer on providing services for 2 undocumented Coloradans, 2 different dates. And I also included the direct link to where you can register for those. So these are some of the service categories that they have on their website. And I just kind of wanted to come full circle with our past resource fairs. And they also have healthcare and mental health, food access, housing support, and transportation support. So here I have pulled up kind of what the food access page looks like. And so as you can see, all the different organizations they work with, an overview, and you can find all the other categories here as well. So we just wanted to provide a little extra resource here because this is such a widely known organization as well. So further ado, I will go ahead and stop sharing my screen, and I want to introduce to you Shoshi Preuss. She is from the Colorado Community Health Network, and I will give you the floor. Thank you so much.
Thank you. I'm happy to be here. So I'm just going to share my screen. Okay, is that working? If I could get a thumbs up or something.
Yeah.
Great, thank you. So hello, everyone. My name is Shoshi Preuss. I am a senior policy analyst of the Colorado Community Health Network. And I'm just going to touch on kind of some basic information on a lot of different programs. So I know we'll have breakout sessions after this. So if you have any questions after, I'm happy to answer more. And my focus will be on the healthcare and health coverage programs for folks without documentation. Excuse me. So first, just about us, the Colorado Community Health Network, or CCHN, is the membership organization for the federally qualified community health centers in Colorado. So there are over 220 clinic sites across the state, and we operate in over 63 of the 64 counties. So just wanted to kind of start and level set, and I'm sure folks know this, but people without documentation are not eligible for most of the federally funded health coverage programs. So, Medicaid, CHIP, Medicare, those types of programs. There are some exceptions for certain programs for specific services, but generally that's the rule. And those are kind of the services that I'll touch on. And just an important thing that I like to share whenever we talk about this is that any information that folks share on an application for medical assistance is confidential and can't be shared with any federal agency. So we know that this is continually a fear, and so that's something I like to talk about, an important point to share when you're working with patients. So first, just wanted to highlight one service is, as I said, I work at CCHN, and the federally qualified community health centers serve all Coloradans, regardless of insurance status, ability to pay, and immigration or citizenship status. Here's a kind of a map of where these clinics operate. And I have a link with kind of more information and where you can find this map. But here, the services available include primary care at all of the sites, dental care, and behavioral health at the majority of sites. Some of those just vary by kind of availability. So this is a really great resource to start. And, you know, depending on the person's income, they will be eligible for a sliding scale fee in order to kind of make it more affordable. So next, as I said, I'm going to be kind of going through a bunch of different programs. So the next one I wanted to talk about was emergency Medicaid. So emergency Medicaid is different than the previous one I just spoke about because it's just for emergency services. So it is kind of this short-term health coverage provided through Medicaid, but not full benefits, in that it only provides emergency care for eligible non-citizens who are uninsured. So kind of the primary groups helped by this are people without documentation, DACA recipients, kind of folks in that documentation status. So it covers emergency care that folks have received in the past 3 months, and that is described as a treatment for life or limb-threatening emergencies. Some examples of what may be covered under this, maybe severe symptoms from COVID, labor and delivery, but important to note that this does not include prenatal or postnatal care. Dialysis for end-stage renal disease, and then kind of life-threatening symptoms, illnesses, or accidents. So these are just some examples. It's not an exhaustive list, and it's not guaranteed. This program is really up to the physician, so they need to decide that it is an emergency care that is being provided, and that's how it is covered. And this doesn't cover any kind of routine physician treatments or kind of follow-up or other care that's not designated as an emergency. I wanted to highlight just kind of eligibility for this is the same kind of criteria as eligibility for any other Medicaid program, except for that citizenship or immigration status. So they still have to meet that income criteria, the age, residency, all of that, except for their immigration status. And you apply for this using the regular medical assistance application, which I linked here. And as I said, it can be for an emergency that's happening kind of at the time of the emergency, or it can be retroactive for the past 3 months. And pregnant people who are using this to coverage for their birth can apply anytime throughout their pregnancy or afterwards. And a highlight I just wanted, a change I just wanted to highlight for this is that beginning in July of this year, folks will get kind of this 12-month coverage period, which means that they won't have, if they have 2 emergencies within the span of 12 months, they will not have to reapply. Previously, folks, and currently folks had to reapply kind of each month or instance of an emergency. So especially, if you have any patients that you're working with who are getting that dialysis for end-stage renal disease, this is a big benefit because we know that they will, continually need this service, but they will not have to reapply each month. And I just want to address, so the question in the chat I see, when you qualify them as non-citizens, are you including persons that are here undocumented? Yes. All of these services, kind of non-citizens is like a word that, is kind of technical and what people use, but undocumented, exactly. All of the programs that I speak about will be eligible for folks without documentation. Thank you. The next program I wanted to touch on is a newer one beginning in July of this year. And it is called the Reproductive Healthcare Benefit Program. And this expands family planning coverage for people also who are not eligible for Medicaid because of their immigration status. So in our context, people without documentation. So this will also provide, it'll provide contraceptives or counseling services based on, for these folks, they still have to, meet those other income and age and whatnot criteria. But it's kind of another way to get this benefit. And the big one, this is billed as, you can get, 12 months of birth control at a time, so that folks won't have to be going back every time to a doctor. So this is another benefit that's coming on. And I had a question here. So what is the age, and will it cover LARC, or long-acting reproductive care, I believe it's
Reversible contraception.
Thank you. Thank you. There's no age limit for this. So it is eligible for anyone who, needs it. And then, yes, it will cover LARC. It may cover, IUDs, kind of any, it defines as any kind of contraceptive device or product that people will need. And then,
Shoshi, what's the process? And I don't know if this is going to be the next slide, but what's the process for applying for this coverage?
That's a great question. So this will be the same. I should have put this on the slide as well. So this will be the same as the emergency Medicaid one. So using that medical assistance application that I linked here, there will be a question that is being added to the application that specifically says, is this person interested in applying for emergency coverage and reproductive health care services? So it'll just be a yes, they are interested in that, because those folks will not be eligible for full Medicaid, so they would not be applying for themselves. But maybe if they're applying for a kid, one of their kids who is documented and can get those services, they can kind of tack that onto the application and say, yes, I'm interested in that.
Okay, but anybody who's undocumented who does not qualify for emergency Medicaid due to any of the life or limb situations, they would specifically be filling out this Medicaid application in order to access LARC or contraception?
Regardless of if they are eligible for emergency Medicaid because of that life or limb or not, they can all fill this out, yes. This is kind of the way that, emergency Medicaid, and with this kind of new question that's being added, we're using it basically as a screening tool for these programs. So, let's kind of check eligibility for emergency Medicaid and for this reproductive health care benefit. And then if they have an emergency, then it will be covered. But for this reproductive health care one, since it is that same population of mostly undocumented folks, it's just kind of the check, are they interested in applying?
Okay, thank you.
Yeah. So some other just different programs I wanted to cover. There's an expanded hospital discounted care program. So this is starting in September of this year. And so this was because of a bill that came out in 2021 that basically created this kind of standard sliding fee scale for co-payments for all hospital discounted care in this uniform application. And also this requirement to screen all patients for eligibility for any public program. So that includes emergency Medicaid as well. And people without documentation are eligible for this hospital discounted care program. And so this is kind of another way, if they need to go to the hospital, it may be an emergency or it may be an elective service. Say they need an elective, procedure. This is another way to cover it, and it kind of caps the amount that they would have to pay, as opposed to, being held that they have to pay the full hospital bill. And this is eligible for households with incomes up to 250% of the federal poverty level, so slightly higher than that regular Medicaid level. Another program is this program called CICP, or the Colorado Indigent Care Program. I wanted to highlight this one because some of you may be aware of it, but it is changing and will now be in July of this year, will now be eligible for people without documentation as well. They kind of removed this lawful presence requirement. So opening up eligibility to a bunch of new folks. And so this one is kind of it's not a health coverage or health insurance program, but it's a way to get discounted care services at certain hospitals and clinics. So they still, meet these income guidelines. They have to not be eligible for Medicaid or CHIP, but anyone who is undocumented would not be because of those immigration requirements. And they have, co-payments for their services depending on their income. So this is a new program that folks will be eligible to apply for starting in July. And then lastly, this is a program I wanted to highlight. It's not a public health insurance program, but it is private insurance starting in this upcoming year. So for the 2023 plan year, which, you start this application in November for that year, Colorado is creating these new state subsidies to buy health insurance through the state-based marketplace. And these state-based subsidies will be eligible for folks without documentation. So this is, generally the federal subsidies, people without documentation are not eligible for these. So Colorado has said we would like to provide the state one. And so these are for people who are uninsured with incomes up to from 0 to 150% of the federal poverty level. This one is specifically targeted at undocumented Coloradans. And this is kind of a new program this year. With the subsidies, it will be kind of very low cost. I've heard, kind of very low cost or zero cost plans with kind of high value plans. And this it's a benefit also because currently if anyone tries to get anyone without documentation, if they try to buy private insurance, they have to do it off the marketplace, which means that they don't get any subsidies and it may not be regulated to the same level. So this is a really great new program that we're encouraging a lot of folks to apply for. And I have some more information on this below, and Connect for Health Colorado, which is the state-based marketplace, will be doing a lot of outreach around this as well. And I just wanted to plug kind of this thing. It's not coming for a while, but this change coming in January 2025, Health First Colorado, which is the Medicaid program and CHIP coverage, will be expanded to pregnant people and kids who are undocumented. So people who meet the other criteria but are not eligible because of their immigration status. It'll be kind of a state-run program, kind of a look-alike essentially for these folks to give them this coverage. So this is, in the ramp up. The bill was just passed this past year. It'll take a few years to implement, but this is something, coming in the future that will be helpful. And I put my information here as well. And I know that there were some questions in the chat that I didn't get to, but I'm hoping we can. I know I took a little bit over my time, so I'll stop sharing and pass it on, and then we can get to answering some of those questions in the breakout room. Thank you.
Thank you so much. Appreciate that, Shoshi. All right, our next presenter is from Vuela for Health. Her name is Diana Pineda, and I will go ahead and give you the floor. Thank you.
Thank you very much for this opportunity to talk to all of you. And I think I love it that I'm go after you, because I think we are the other side. And this is exactly what we are doing, this partnership, how we can pass all this message to our community. Because all of this information for many of us is new, many of us we don't know. So our community doesn't know anything, and it's a tons of questions about, can I apply it? What is the risk that I am? And we are kind of that organization that is the trust in the community, how we can be there and how they can really receive the information that they want. So I'm going to start sharing my screen. Here we are. Oops, and I'm start, of course, in the end of the presentation. So let me go to the beginning. So we are a nonprofit. We are focused in the model of health promoters, promotores de salud. We are focused directly in the Latino community, more in the Spanish speakers. So we working in different programs. Everything it's about in prevention on health, and referral to the community, to the place that they can receive the support that they needed. So we have different programs, and this is more the model that we are working in, that we see the individuals that in general know how they can really find, or they can really start working in what they needed about the health. So we work with the leadership that I say with the health promoters, promotoras de salud. We are a team of 30 of us that we are teaching the class and be in the recruitment and everything around it. We have our ambassadors that it's more like our ex-participants or leaders in the community that want to have the training that how they can pass the message, and our community advisor committed. So all our programs, we really believe that it's not only about what is the message that you want to pass. We are really looking like the message is really with a cultural component. We really understand what is happening and how can be received in the best way to our community. With everything, no? Starting with Medicaid and all of these regulations, that while I cannot lose the way when we are in all of this stress, no? How I can go to the doctor when I need to work full time, or I don't see the time that I can do it. So for that one, we have some programs that is in the social emotional wellness, that we have different programs. We working directly with all partners. Our curriculums are evidence-based curriculums or coming with evidence-based practice. We only pass the message. We are not the experts. We are not doctors. We are not nurses. We only receive the message and then we pass it in the best way. And in the social emotional wellness, actually, we started 5 years ago when we see this big need that you cannot talk to me about losing weight or go to the doctor when you don't understand where I am. So it's actually that is part in our community that we are doing the youth mental health first aid curriculum, talking about mental health, but we never use the word actually mental health. We're talking about, do you want to understand better your feelings? Or do you want to understand better where are your kids coming from? Or what is the best way that you can communicate with them? So for that one is Luz y Claridad, that it's really more like doing art, different workshops with art, that the people can start expressing themselves. And then we go with Confianza, that is another program that we have with Caring for Denver, that give us the opportunity to really say like, what is this auto-empathy and empathy? How can you understand what happened in you, and then you can understand others? And all of that one, in the one way or another one, is who is coming first? Because we was doing the physical wellness, many programs like Charlar programs with the Colorado Prevention Center that we are doing for the last 15 years. And we are doing DPP, the Diabetes Prevention Program with Denver Health, and we are doing it for 12 years. Diabetes control, that is specific with Denver Health too, for people that already have diabetes. We are doing breast cancer and cervical cancer with the state, with CDPHE, education and referral to the clinics. And of course, we are in COVID. We are one of the centers for COVID in the CDPHE. So we are doing clinics in different places. We are directly in the community. So I think when we start with Charlar and DPP, that is 12 years and 16 weeks, is when we start actually looking like it's not fair to asking the community to do something when they are really in another place. Actually, right now, with a really beautiful partnership that is, I think, part of what I want to say that is a big success of Vuela, is this partnership that we have it. We Charlar with the Colorado Prevention Center and actually with DPP, with Denver Health, and our really beautiful board that we have. We implement and actually in these classes mental health. Know how really to take a decision that where you can go, that I apply or not apply for Medicaid, or I go or not to the class or to the doctor. You need to figure out what is happening first in your brain and why it's really hard to take the decisions. So this is the physical part, but of course, that I say, we go really directly with the emotional wellness. So that is some of the programs. And of course, we have many programs, and I know I don't have the time, but I'm really open, and I will love to have in contact with you to see how we can partnership, because all our programs are free for the community. All our programs are in Spanish. We have programs in distance learning that is not really virtual, no, but we have that one with the modification of COVID, and we have in-person programs. So this is like Charlar, that is actually 12 weeks. Sorry that here's 11 because it was 11. 12 weeks that talking about how can you prevent a heart disease, or DPP, that is 16 weeks, the first phase, and then 18 and then 1 year. Or with Cooking Matters, we have this collaboration too, that actually our classes in Charlar and in DPP have part of the Cooking Matters and the breast cancer that is in the area of health, physical health. And then in the mental health wellness, we have the communication is the key, that is the way that we start talking about mental health. No, here is like a workshop. Here is like a more general information that what this means, because it's a big stigma around it that we know. And then we can have your mental health, or we have actually this like strengthening families with the city of Denver, that is more like a communication between the families. And there are other programs that I tell you before. So I already talked about this one. And how we do the work, I think this is something like it's really important for us, that is different phases of how can you touch the community. And I think we need to go again, like many times it's like, here's a flyer, or actually we have some partners that they call us and say, can you pass information only in your Facebook, or can you pass these flyers in the community events? Yes, we can, but we know that the paper, it's not really who is going to do the difference. So we go to all of this when I run it. We have media. No, we are, of course, or Facebook is the more interactive media that we use it for the community that we are service. But we have the radio program. We have a radio program every week in the 11:50 a.m. with Rodolfo Cárdenas, that is a big personality in our community. And then we have the community events. The community event is where we are with a table with our partners. We have a really strong partnership with the churches, more with the Catholic churches, for the volume of community that they have every weekend. We are there. We are there passing the message. We are there with a table. We are there in the newsletter. So any way that we can have this trust. And I think that is an important way for us, no? How we can have the priest or the pastor telling them that is fair, or that is safe to talk to us. And it's why we have this integrity of programs, no, really high, and see how we never pass the limits, or we never share the information to anyone else. Then from there, we have another way, that is the introduction workshops that I say, I think with breast cancer or cervical cancer, or actually with mental health. Before we ask that you want to sign to 8 hours, or actually to 12 weeks or 16 weeks, we need to give this education. We need to take this time to say what we are going to talk about it, or why this is important for you. So we do that once. We can do it in virtual or in a distance learning, or we can do it in a person. Then from there, and the participants sometimes, they don't have the time to go to a class, or maybe they apply for a class. So it's when we refer them to a specific class or program that we have, when they want to have more in-depth information. Or here is when we start doing all the referrals. After the education, after to listen to them what they needed. And what is exactly that I think I love it for the past presentation, that we don't want to send them to a system that we don't know, we already know that they don't qualify. Or actually is why we love to know more about all of you, because that way we know, like, yeah, some people can apply for some of them know, some communities open, some of them know, some of them have the language, some of them know. So, but that is something that for us is like, try to refer them to a place that they're going to receive the support that they needed in the more capacity that they can. And that is when coming the one-on-one that can continue the education, or we have the case manager or the referral. So, and I think there is something that for me, for us, is really important, that take the time, take the time to really understand better where they're coming from, or what they needed, and what is all these barriers that they have it, or we have it in our community. So I think, okay. Yeah, so we working that I say with many different partners. This is some of them, because again, we are not doctors, we are not nurses, we are the community, the organization that we can have this trust in our community. And we working with all of the team and our community advice to really reflect how the message is passing in the best way. So here is my contact information. I'm the executive director and founder of Vuela for Health. I'm a health promoter. I'm a promotora de salud for the last 20 years, and I love to do it. And that is the first role that I have, and I will love to come back there more time because I love to teach the classes. Because I think that when you are in the community, you really know what are you talking about. Sometimes when we are in front of the desk and the computer, we forget or we are a little missing that information. And so you can call me here, or send me a bit here, but if you are talking to the community, the way to contact us is this 180 numbers, the Facebook, or you can go to your website or send us an email. So I think I'm going to stop there because I want to see if you have any questions. But I think in general, what we are doing, we are this bridge between our community and the organizations and the programs, giving education, not only giving you can go there. Actually, the way that we refer to the clinics is we using a three-way call, because some of your systems are a little crazy and some of your systems are really difficult. And this is the best way to do it, is working together, because for us, we cannot do the magic that you are doing inside of your clinics or inside of your organizations. And then it's really sad that you have a beautiful programs, but our community doesn't know about them. So how we can really match that bridge and do the best for everyone.
Awesome. Thank you so much, Diana. All right, I'm going to go ahead and open up the breakout rooms. CCHN will be in the first one. Shoshi will be in that one. And Diana for Vuela for Health will be in the second one. After about 7 minutes or so, I'm going to end the breakout rooms, reset them. And if you want to join a different organization, you're free to do that. Or if you still have pending questions with the first one that you joined, you can hop back in that one. All right, I'm gonna go ahead and open those up. And don't forget, if you need me to put you in one, just put it in the chat and I'll stay in the main room for a bit. Thank you, everyone.
Hi, Rena. Can you assign me to one, please?
Yes, is that Elizabeth?
Yes, always.
I'll put you in Vuela for Health right now. Cool?
Okay, cool. Hello, it's not working.
Hello,
Yes.
am I supposed to be talking or?
I don't know what happened with my computer, but I'm here.
All right, I ended it real quick so we could get back to, or switch if you want to. Elsa, how do you reset those breakout rooms? I'm trying to find it real quick.
Can you hear me?
All
Hold
right.
on, we're resetting the rooms.
I can hear you.
Here, I'll do it real quick.
Okay, thank you. And while she's doing that, I just wanted to remind everyone that we'll be sending out a follow-up email with all of the information you learned today, links and contact information, and we hope to see you again in the fall for more resource fairs. And feel free to fill out that evaluation form to let us know what you want to see for those. Thank you.
All right, the rooms have been opened, so you can choose which one you'd like to join.
Can you send me to the CCHN, please?
Yes.
Yeah.
Thank you.
Does anyone else need assistance moving to a breakout?
I can stay in and if they need.
Okay, I'm going to CCHN.
All right. Thanks, Elsa.
Mhm.